Thank you for taking the time to join another Zoom meeting. Um, I grew up in Whitefish. I went to University of Idaho. I went to medical school in Southern Israel at Ben Gurion University Medical School for International Health. And then I did my residency here in Seattle at Group Health, and I currently work here in Seattle. Um, After I finished residency, I had the opportunity to work at the Research Institute here in Seattle, when they were doing a pandemic preparedness study for a novel influenza virus that was circulating in China in 2013. And so the federal government did a vaccine preparedness study basically for the situation that we find ourselves in now. So at that time, I started my work with them, and then I kind of moved on to other jobs and started my current job in 2015. Um, so in January of this year, when things really started to demonstrate that this circulating virus was continuing to spread, uh, and it looked like we were going to have an kind of unprecedented public health event, I reached out to the Research Institute here and just said, hey, I don't know if you're going to be working on the vaccine for this virus, but I'm assuming that you're going to need some help. And my inquiry was quite timely because they were applying for the phase 1 study that was Moderna's phase 1 study at that time. About a week later, starting the beginning of February, they were given the phase 1 study for Moderna. I think it's really important with any medical talk to make sure that it's clear that you give your financial disclosures. I don't have any financial disclosures. I will not be getting any money from Moderna. I will not be getting any money from Pfizer. So I don't represent them. I'm just here to really answer questions as a Montanan and a medical professional. The genome that they developed the vaccine off of was published by a scientist in China on January 10th, and they gave their first vaccine just 66 days later, which is a really remarkable timeline for an investigational product. They utilize a technology called mRNA. So mRNA stands for messenger ribonucleic acid. And what that is your cells all have a nucleus, and that nucleus is full of DNA. That DNA is basically a software of sorts. It's a coding. That coding needs to be turned into from a double strand, which is DNA, into a single strand, which gives the coding that we need to pull in amino acids to make proteins. So when the genome was transcribed in China and released to the public via a Twitter post in January 10th, we knew what the genetic makeup of the virus was. And so scientists were able to then look and see, well, given prior research into coronaviruses, specifically early in the 2000s when there was the first SARS epidemic or outbreak that did not turn into a pandemic because it was isolated by public health measures, they knew that the spike protein was going to be the target to develop an immune response via vaccination. So had that genetic sequence, they were able to just find the mRNA code that would correspond with the spike protein that they were seeing sequenced. They were able to just use that spike protein coding uh, encased in a lipid um, molecule of sorts, and that's how the current vaccinations were developed, and that was done really within a weekend. The part of this that's unique is that mRNA has been researched as a potential target for therapeutics for decades, but there are not any mRNA vaccines that are currently available for humans. There are some for animals that are on the market, but they knew that this would be a way of producing a viral sequence that could provoke an immune response very quickly. And that's one of the parts that's most unique about this, is that they were able to do it so quickly because they did not need to isolate the virus itself in order to produce viral particles to develop a vaccine. They're utilizing your body's uh, uh, cellular biology to produce those viral components themselves. So these vaccines cannot give you coronavirus. It is impossible to give you coronavirus via these vaccinations. I will say that again, you cannot get coronavirus via these vaccinations. All that these vaccines do is they give you a sequence of messenger RNA for the spike protein. That spike protein is the thing that gives coronavirus its kind of crown appearance. So what your body ends up doing is your cells take up that mRNA. Just the regular cellular biology with all of our cells turns that mRNA into a stabilized spike protein, but just the spike protein. Um, it then presents that to your immune system, and then your immune system develops an immune response that results in antibodies to just the spike protein itself. So there is potentially a window period in which you could be susceptible to coronavirus, the natural infection, after vaccine. And it seems like at this point in time, that window period starts from day 0 to day 10 at the beginning for the Pfizer vaccine. But really, I wouldn't consider being fully immune to the virus until about 14 days after the second dose. These vaccines are, I think it's important to note that they're not all exactly the same, but vaccines in general follow the same principle. They need to expose your body to either a virus or a bacteria in some part so that your body develops an immune response, with the objective being that that immune response ends up being persistent. It lasts for a long time, so that if your body does end up being exposed to the actual naturally occurring virus or bacteria, that it has developed an immune response that can isolate the virus or bacteria. Every researcher is taking ethical trainings at the beginning. It's really important to note that when we are enrolling subjects into these studies, these are all people who have presented of their own volition. So they're all volunteers. They get a nominal amount of reimbursement for their volunteering to be a part of this study. Every study utilizes an informed consent process with various lengths of informed consent based on the study, but the informed consent process re requires a consent form for the patient or the volunteer to review and answer any questions before they sign to be a part of the study. I think it's really important to note that anybody who participates in these vaccine studies can leave the study at any moment for any reason. There is nothing that requires them to stay within the study if they do not desire to proceed any further. And there wasn't anybody that we actually exposed to the virus. We either gave people the vaccination or we gave them a placebo. I was one of the blinded participants, meaning that I had no idea what the volunteer received. Um, and then we monitor them afterwards, giving them education about if they have any symptoms that would correspond with coronavirus, that we would need to be notified by them. For the Moderna study, in which we enrolled 30,000 people across the United States, 15,000 of those who received placebo and 15,000 who received the investigational product. We then monitored them and we found that there were 185 COVID cases. And then those were the 185 COVID cases were in the placebo group, and that there were 11 cases in the vaccinated group. But there wasn't any actual exposure to the virus that we did, what we gave to them. This was all people who came in contact with the virus just within their community lives. How long they are effective is still to be determined. We are just rounding the corner right now to natural infection 1 year later in Wuhan. So we don't actually know how long natural infection lasts in terms of immunity until just about right now, when probably the first cases were starting to circulate in China. So I think that we'll have a little bit more information about natural infection, coming up in January. Um, what we have seen in terms of the vaccine versus natural infection is that the vaccine actually produces more of an immune response than natural infection. And that's been in both the Pfizer and Moderna studies. And what we're seeing is that the vaccine actually produces about 2 to 4 times the amount of antibodies than natural infection does. Herd immunity is a really important topic, but I think that we need to talk about how we get to herd immunity. Um, Herd immunity can be done through natural infection with all of the risks that go along with natural infection, or it can be done through inoculation or vaccination. Um, so I would argue that the vaccine route will be safer for our communities than the possibility of just, kind of the Russian roulette of whether or not you will end up developing severe infection from natural infection. So what is herd immunity? Herd immunity is when you get to a certain threshold within the population that the disease is no longer able to find what we would call as naive individuals. That doesn't mean naive as in they don't have, a certain level of consciousness. That might be naive, means that their body has never been exposed or seen this particular antigen, meaning this particular virus. So at this point in time, what we are seeing is that, when you look at some of the trackers that have been coming out nationally, most of whom are being populated by Johns Hopkins University, uh, they are reporting that there have been 15.4 million reported cases just in the United States, and that there have been 70,191 cases in Montana. Now, let's just say conservatively, let's double that and say that that's probably closer to the number of people who have actually seen these. So that means that there might be 30 million people across the United States who have been infected with COVID. The population of the United States is 330 million people. So if we're seeing right now, as of today, when I looked at the tracker, 289,531 deaths across the United States. Let's just say that was in 30 million cases. If you say that we need 70% of the population in order to have either natural infection or vaccination in order to get herd immunity. If we were to go the natural infection route only, that would mean that we would have over 2,220,000 deaths in the United States. In Montana, that would mean, let's say that there's been 140,000 cases in Montana, and there's about 1 million people in Montana. We would be looking at about 5,507 deaths. We've only seen 771 deaths in Montana. So we're not even like at the tip of or we're only at the tip of the iceberg in terms of the amount of people that we would see coming through the hospital intensive care units, needing to have access to ventilators, staff to have those ventilators, nursing staff to help run intensive care units. It is a really dramatic number to think that we would need over 2 million people die in the United States in order to reach herd immunity via natural infection. So, let's talk too about what we're seeing in terms of side effects from these vaccinations right now. We are seeing, in general that people are getting pain at the injection site, fatigue, and headache. I would argue that those types of side effects from an inoculation are much better than the possibility of a severe coronavirus infection that would require hospitalization, hospital services, intubation, and potentially the risk of comorbidities resulting from the infection and or death. So I think it's really important to note that, you probably are going to be feeling that you got vaccinated afterwards, but a lot of times we attribute those feelings to us getting sick. But really what those feelings are is just activation of your immune system. So your immune system needs to send out certain chemical signals in order to recruit the T cells and B cells that it needs to activate and produce immunoglobulins to protect you. Those chemical signals are the things that kind of make you feel sick, but ultimately they are actually a good sign that the vaccine that you received is working. Because if you're feeling totally normal, then your immune system may not be as activated as we're hoping. Um, so those chemical signals, they're the things that travel into your brain. They help regulate your temperature. So they will usually increase your temperature some. We haven't seen fever as a result of these vaccinations as much, but we have seen people getting chills more than fever. Body aches, muscle aches, joint aches, those are the types of things that we see as a result of the activation of your immune system. And again, I'd like to reiterate that in this situation, that's probably a good thing. That means that your body is responding and hopefully producing a robust immune response. And I will
Okay.
also say that for the most part, those symptoms lasted for maybe 24 to 48 hours at the most. And for the most part, people said that they were easily controlled by antipyretics or analgesics, meaning a dose of ibuprofen, a dose of naproxen, Tylenol. The second dose is worse. And what that is because um, the first dose ends up kind of priming your immune system. It exposes your body to something that it's never seen before, and it might say, "Oh, this looks foreign. I think I need to react to it." And so it reacts to it by uh, it, through various chain of events, producing immunoglobulins. The second dose, your body says, "Hey, I'm seeing that thing again that I had seen before. We got to make sure that we combat this." And usually that's where your body produces a more robust response. And that's when we really see the level of immunoglobulins rise is after the second dose. And so I think it's really important to reiterate that most of these vaccines are 2 doses right now, the ones that are being considered for emergency use authorization. Um, it's really important to get the second dose of the vaccine because that is where we're seeing the most robust response. The Pfizer vaccine in particular needs to be very, very cold. However, Pfizer has been saying that the vaccine itself can be stored, in a regular freezer for up to 5 days after it's received, before it would have to be discarded. So that is a little bit more durability. I think it's important to note that we are going to be seeing other types of vaccinations that are going to be coming onto the market that have better storage at, refrigerator temperature or even at room temperature. These are the types of vaccinations that might end up being single dose, and they are probably the vaccinations that will be very useful for parts of the developing world that may not have access to these deep freezers. We're very limited in our tools. So having the capability of protecting our communities through vaccination is a monumental achievement. What this will mean is that given uptake within the community to pursue vaccination when they are eligible to do so, we are going to get closer to herd immunity through a new mechanism that's not natural infection. What this means is that if we're able to get the effective reproduction number low and we actually see the curve dropping from state to state and across the nation, that will mean that the country can open up more. We can potentially start gathering in smaller numbers. Uh, I think that it means that there's a good likelihood that September 2021 will start to look a little bit more like normal. It will need a high percentage of the population in order for us to really see a dropping of the curve. And what does that mean? I suspect that we are going to need to have 70 to 80% of the population immune to this virus in order for us to start returning to some normalcy in our lives. This vaccine has been rigorously tested, the same as other vaccinations that we see that are marketed, because they've been approved through all of the normal channels within the FDA. So I think that we have seen so far that there has been really great safety with these vaccines. So far, the Moderna vaccine has not had any serious adverse events that have happened, meaning really bad side effects. We've seen, like I said, normal kind of vaccine side effects, injection site pain, fatigue, and headache. Um, what I would say is that we are a little bit between a rock and a hard place. I think that uh, going about with the risk of natural infection is much more pronounced than the risk of some minor side effects for a limited number of time after a vaccination. Um, I think that if we're wrapping things up, the takeaway points that I want to give people are: you cannot get coronavirus from these vaccines. Again, you cannot get coronavirus from these vaccines. It's not possible. Um, you, the ones that are being evaluated right now are all 2-dose vaccinations. If you want to have a robust immune response to help protect you from natural infection, please complete both doses. What I would, in terms of the way that hopefully your mentality is going into the vaccination, is that you probably are going to feel a little bit ill afterwards. And that is actually a good thing. That means your body is responding to the vaccination and helping produce an immune response to the vaccination. And that you're probably going to feel more ill after the second dose of the vaccination itself. It's amazing that we're at this point in time. I hope that what the history books show from this is that science really stepped up to the plate and they hit a grand slam, as my mom said, in the 6th game of the World Series. So I really I guess what I can say is I will be getting vaccinated as soon as I possibly can. Um, I hope that everybody will also lend their normal cellular biology and their normal immunologic function to getting vaccinated rather than risking natural infection at this point in time.